Hello, my name is Dr. Hopkins, and I am a venous and lymphatic medicine specialist, as well as a general surgeon. And I'd like to go over with you a little bit about venous disease so that you are a little bit more prepared prior to your appointment to see me. We appreciate you spending the time to look over this video. So let's go ahead and get started. In summary, I'm going to go over a little bit about the anatomy of the venous system, what we call venous reflux disease. I'm going to go over a little bit about how we diagnose venous disease with ultrasound, and then how the disease presents with signs and symptoms. I'm also going to go over the treatment. The circulatory system is somewhat complex, but it can be simplified a little bit in that, we have arteries and veins. Okay, the arteries are designed to bring the blood down to the tissues, and the veins are designed to bring the blood back. So we have in the artery system, a pump. It's called the heart, right? So it pumps, and then as it pumps all the blood down into the tissues. But then once it gets there, the blood has to get back. So we have to have another pump to pump the blood back. And that's why we have what we call the calf muscle pump. So in our legs, we have muscles, and every time we pump our ankles, we pump the blood back. And it goes through the one-way check valves as it gets pumped. So the little one-way check valves that close, and then it gets pumped up to the next valve, and that valve closes. And as long as the pump is working well, and as long as the valves are closing, the system works pretty efficiently. But sometimes those valves don't close properly, or the pump system doesn't pump properly. And in that situation, we have some problems that we're going to go over how we diagnose and treat those conditions. So in general, the venous system is such that we have deep veins, we have superficial veins, and then we have veins that connect the two, and those are called perforator veins. Okay, all of those veins have little one-way check valves, and the blood is always directed from the superficial to the deep system. But there's a lot of superficial veins in our legs, and that is helpful because it's what we call a parallel circuit. If there's lots of superficial veins, then you can actually eliminate or treat superficial veins, and there's no problem with that because the blood then redirects and reroutes to the healthy deep veins, which do have valves typically that work properly, hopefully. So here is a picture of our venous system. As you can see, we have deep veins and superficial veins in this depiction. And then in this next slide, you can see this is the great saphenous vein. It is a superficial vein, and it is probably the most common vein that gives us problems with regards to those valves not working properly. And it's located over the inner aspect of the calf and the thigh. And then over the back of the calf, we have the small saphenous vein. As you can see, it also has, it's usually fairly straight, and it has also those small valves which open and close. And those are superficial veins. And this is kind of more of a three-dimensional depiction of the venous system. You can see the great saphenous vein is there, and as well as small spider veins, which are right next to the skin, and they look like that. And then you have these little smaller reticular veins, which are purple typically, and those are slightly bigger than spider veins. And those are a little bit deeper typically. And then we have the larger varicose veins, and those are the ones that more commonly cause symptoms like aching, pain, heaviness of your legs, and they bulge as shown. And those are called varicose veins. Now under those is what we call the axial veins, or the typical example is the great saphenous vein, or one of the saphenous veins. And those are fairly straight usually, which is why we can usually treat those with a catheter ablation by placing a catheter into those veins if they have the valves that are not working properly. And so that just kind of gives you a general overview of the three-dimensional anatomy. Now we're going to talk about venous reflux. So venous reflux is basically leaky valves. Okay, I call it leaky valve syndrome. If your valves don't close, then you can see the blood in a normal vein goes straight up through the vein and the valve closes properly. If you have a vein that's diseased and it has valves that don't close properly, then the blood pools in the leg, and that increases the pressure in the veins. And any tissues, whether it's a vein or some other tissue, they don't like it when they're stretched. Okay, there's nerves in our tissues, and when those nerves are stretched, it causes symptoms like aching, pain, heaviness, and that sort of thing. And that becomes a problem. So we'll go over how we diagnose and treat that. So this is just another depiction of what happens when the valves are working properly on the left, and then when the valves don't work properly and don't close, then the veins bulge, and you can see that's that's when they turn into varicose veins, okay? And you can see both the varicose vein here and also what it looks like in a real person when they're bulging and usually symptomatic. So here's some more veins that we have, and those are all typical varicose veins as a result of this venous reflux disease or leaky valves, okay? So, it's really common in general in terms of venous reflux disease. It's like 20% of the population has it. It's about, I think it's about 25 million people in the country have venous reflux disease, and so it's a very prevalent problem. And about 5% of those patients that have it have more chronic problems. In other words, they start to develop a lot of skin changes or even venous eczema, and they might even develop actual venous stasis ulcers, and we'll show you what those look like. It's much more common in women than in men as well. So let's go over how we diagnose this problem. So it's done with what we call ultrasound or duplex ultrasound specifically. We can not only look at the veins, but we can look at the flow through the veins. And we basically have you standing when we do the exam, and then we squeeze your calf muscle, and that pushes the blood up toward the heart and the lungs. And then we can measure if the valve closes or if the valve doesn't close. So we can see the blood flow. And you can see with this depiction that the flow going through the vein is when the blood is going in the wrong direction. The valve is supposed to stop the flow, but if it doesn't work, then the blood goes down toward the feet and the lungs, and it goes down toward the feet, and that's what causes the aching, the pain, the heaviness, the itching, and the burning, and that sort of thing. And you can see that in real time in this next video here, where we squeeze the calf muscle right here, and that squirts the blood up. And then once you release the compression, you can see the flow going the wrong direction. Okay, and that's all venous reflux disease. And then after we do your ultrasound, we do what we call a venous map. So this is a depiction of a venous map. It's a two-dimensional diagram of what is essentially a three-dimensional study, and it allows me to see what's going on with regards to your venous anatomy and where the valves are working and where the valves are not working, and it guides treatment, which is really the big benefit. So ultrasound is a non-invasive test. It's not painful. You do have to stand for a few minutes, but it's very, very nice and very accurate. So I'm going to go over the symptoms. There's symptoms and signs. Symptoms are what patients complain of in terms of what bothers them as a result of this venous reflux disease. And the typical three are aching, pain, and heaviness. I see that over and over. Those are the three most common symptoms. But patients can also have other symptoms like tiredness, fatigue, cramping, throbbing, numbness, restless leg symptoms, itching, and they can also get, they also sometimes complain of swelling if it becomes more advanced. It's usually if they have more venous reflux, they can have swelling. And so I'm going to show you what the veins actually look like. These are as a result of venous reflux. So here's a spider vein, and that's just a tiny little spider vein, and that can occur as a result of venous reflux, as does reticular veins, which are just the smaller blue veins. And then you get the bigger, larger bulging veins, and those are called varicose veins, and that's typically as a result of venous reflux. This is called an ankle flare. The technical name is corona phlebitictica, but when people have like an ankle flare in their ankle like that, that's usually associated with venous reflux or leaky valves in the great saphenous vein. So that's something to look for. As this condition gets worse, you start to get more inflammation, okay? So venous reflux, for some reason, causes, which we don't understand completely, but it causes inflammation. And that inflammation can present in many different ways. It can present with just edema and like pigment changes of the skin. We call it hemosiderin pigmentation. Here's another example of, hemosiderin pigmentation. And it's basically the iron in the blood staining the skin. It's like the body tattooing itself, because the iron is a pigment and has a heme pigment in it, and it can stain the skin, and that causes hemosiderin pigmentation. Patients aren't always symptomatic just because they have pigment changes, but as it gets worse, you can start to get more inflammation. This is called atrophy blanche, which is a white kind of appearance to the skin in the ankle. And then you can get actually inflammation of the subcutaneous tissues, and we call that lipodermatosclerosis, and this is an example of that. And that's basically inflammation from all this increased pressure in the veins as a result of the valves not working properly. Skin changes can occur, and that's called venous eczema, and that's not too uncommon. And then when it really gets bad and it goes on for many years, there can be so much inflammation that it actually can cause a venous stasis ulcer, and that's when the skin actually breaks open and causes an open wound. And we want to try everything we can to prevent this from occurring, which is why we try to treat patients early rather than late, especially when they start to have symptoms. So a lot of people ask me, what caused this problem? Well, we don't really say it's what causes it, but we can tell you that there are risk factors. Certain things that are risk factors, some of which you can control, and some risk factors that you can't control. So the ones that you can control are weight, the lack of physical activity, smoking. If you stop smoking, that will help. And then pregnancy is kind of a controllable factor as well. But the things you can't control really are your genetics, your age, and whether you're male or female, because women tend to have this much more common, and usually it's because of the pregnancy increases the risks, and but you can't control that. So those are the risk factors, and there's a big genetic factor in terms of this condition. If both of your parents have venous reflux disease, you're at least 90% chance of you're at least at a 90% chance of having the condition. If only one parent has this venous reflux disease, then you're about at a 47% chance. And then if neither of your parents have venous reflux, then you're at about a 20% chance of having venous reflux. So it's a very common problem, okay? Very, very common. So we're going to go over treatment. So essentially, we have various types of catheter-based occlusion techniques, and I'll go over those. But we have catheter-based occlusion techniques to treat venous reflux. We have surgical techniques where we actually use a procedure called microphlebectomy, where we hook and remove. I call that the hook and the remove technique. And we also have sclerotherapy, where we inject veins with a chemical to help injure the inside lining of the vein, and that helps to close down the superficial veins. That's usually, but not always, done for cosmetic reasons, more so than medical reasons. But those are the standard techniques we have this day and age. Of historical interest, we also have vein stripping. Okay, but luckily we don't do vein stripping anymore because just because we have better techniques. Basically, all the catheter-based techniques, of which there's 4 of them, have replaced the vein stripping procedure at this point. And so let's move on into the catheter-based technique. So we have we can use either heat energy to close veins, or we can use non-heat energy to close veins. So the heat techniques are called thermal techniques, and there's 2: radio frequency, which is essentially microwave energy, and then there's laser, which is light energy. So we can use those 2 types of catheters to close veins. And then we also have the non-thermal techniques, one of which is mechanical chemical, and the other one is just gluing the vein. It's a glue technique to close the vein. So, and there's pros and cons to using various techniques, and I try to use the technique that I think is the best for the particular patient, depending on their anatomy and their physiology and their ultrasound findings. Okay, the most common that I personally use is the radio frequency technique, but we use the technique that fits the patient the best, depending on their anatomy and such. So, this isn't really a definitive treatment, but conservative treatment with compression does help to alleviate symptoms, but it's a way to manage the condition, but it doesn't actually cure the condition or definitively treat it. But we have Velcro garments, which are Velcro straps, essentially, that goes around the calf muscle, and those are a lot easier to apply than compression stockings, which is another type of conservative treatment. But those are all offered here in the office for conservative treatment, and sometimes a patient may have venous problems that we can't treat with any type of surgical treatment, and sometimes we treat them conservatively. And also, prior to any type of surgical treatment, it's helpful to try conservative therapy as well. So here's one of the more common types of catheter-based treatments. This is radiofrequency ablation, and basically we use ultrasound to access the vein, and then we slide the catheter up through the vein. It's really nice because it's really not that uncomfortable. Just a little bit of numbing medicine. We put the catheter into the vein, and then we use ultrasound again to find where the tip of the catheter is, And then we use ultrasound to actually inject a lot of lidocaine or numbing medicine around the vein. And that makes it so that when we actually deliver the energy to the vein, as you can see, 7 centimeter segments, we deliver this microwave energy to the vein. And it just gently seals the vein closed using very controlled heat energy, okay? And this is all done with what we call tumescent anesthesia, which is numbing medicine or lidocaine. And it really helps to make the procedure very comfortable and safe. And you can see we use ultrasound during the procedure to see exactly where the numbing medicine is going. We use the ultrasound to access the vein, and we also use the numbing medicine to administer the anesthetic. Okay, so it's a very non-invasive procedure. It's completely replaced vein stripping, and that's the and all of the catheter-based techniques are similar. They just use a different form of energy, either thermal or non-thermal, to basically occlude the vein, okay, and that's the goal, because then the blood can then reroute to the healthy vein. It no longer goes the wrong direction. The vein is closed, and then the blood can then reroute to the healthy veins, which have valves that do work properly. So that's probably the most frequent question I get is, you know, how can your veins just be closed and not have a problem? And it's basically because there is a parallel circuit, and there's lots of other superficial veins that take over the place of the vein that is closed, okay? And that's either whether we close it or if we remove it. Which brings me to the next thing I want to talk about is, you know, there are some complications or risks that we worry about with these techniques. Bleeding, infection, blood clots, and numbness are the four things that I worry about. Those are rare, but they can occur. And those are the potential complications that can occur with the catheter-based techniques. So this is like a typical patient that I treated, actually, that I performed radiofrequency ablation of the great saphenous vein, and then I also performed at the same time microphlebectomy, where I hooked and removed the veins, and this is like a before and after type of a picture. The last, or second to last treatment that I want to go over is sclerotherapy, and basically you inject a chemical. I typically use polydocanol, but there's about 4 or 5 different types of sclerosants that we can use to basically inject the vein with a chemical to destroy the inside lining or the endothelial surface, to close down the vein so it doesn't, it looks better from a cosmetic standpoint. It can also be used to help alleviate symptoms as well, but it's more commonly used for cosmetic indications. And you can see like a typical before and after picture, what your veins would look like before and after on the left and the right, respectively. So the last treatment that I want to go over is just, you know, I wanted to offer we want to offer a full vein service, and so there are some venous conditions that occur in the face, like these little telangiectasias that can occur on the face, and there's a technique that we use, transcutaneous radiofrequency energy, to basically close those veins, and that's called vein wave treatment. And so we offer that here, and it's typically used for facial telangiectasias or facial spider veins. So that is pretty much it. I hope that this has been helpful to you, and please feel free to look over this video again on my website if you have any questions. Hopefully it's helpful before your appointment when you come in and see me and ask me any questions. Thank you.